Hey, Dorothy, could you tell me who your biggest influence was throughout your education?
I think I'd have to say my biggest influence was Florence Nightingale. I really liked her book, Notes on Nursing. I really enjoyed it because, she focused on the person rather than the disease affecting the person.
All right, and where did you develop this theory?
I was a professor of nursing at UCLA, and through that I was able to research and do more clinical experience and implement it. And through my clinical time, I focused on the nursing process. And while I was doing that, I really wanted to hone in on the patient's progress. And, while doing that, I wanted to make up interventions that are designed to support, maintain health, educate, counsel, and modify that specific patient's behavior.
Dorothy, could you give us an overview of your behavior system?
All the pattern, repetitive, purposeful ways of behaving that characterize each person's life make up an organized and integrated whole. The behavior is the system, not the individual. The person is striving towards a balance.
So what is the focus of your behavior system?
Each person has a bunch of subsystems, is what I like to call them. And those subsystems are the affiliative, the aggressive, dependence, eliminative, ingestive, and sexual.
And Dorothy, how do you reach your goals of the subsystems?
Well, it's kind of unique to each person, but they go through 4 different ways. There's the universal drive, and that is when variations that occur based on the value placed on the goal and drive strength. So what each person thinks is most important. Then there's the set, the way that each person has a tendency to act in a certain way in a given situation. There's also the choice, which is the alternate behaviors that the person considers while making their decisions. And the action, which is the observable behavior of the person. And you find balance by maintaining internal and external environment cohesion, and when all your subsystem goals have been met.
Thank you. And Dorothy, also, how do you apply this theory to your nursing practice?
You have to focus on the holistic care so that the patient's goals are all met and all their needs are met, not just the medical needs.
All right. Thank you very much for answering our questions, Dorothy.
Thank you.